A very good evening to one and all. And I, Dr. Praveen Kumar Patil, warmly welcome you all to this live chat, live talk on an insight into pursuing postgraduate diploma in IMU by our own Professor Seow Liang. Before start of our actual session, some housekeeping rules. Number one, we have muted the microphones for all attendees. Number two is for question and feedback. Please use the question answer panel. And number three is this live session will be recorded. And I have one more interesting announcement before start of this live talk is about our virtual open day, which is happening on this Sunday, 24th January 2021 from 10 a.m. morning till 4 p.m. evening. And one of the major highlights of this particular open day is a live chat with our own faculty members. So you can have a one-to-one chat with them to get know more about your programs you desire to join in IMU and enjoy application and registration fee waiver up to almost RM 800 for all programs except medicine and dentistry. Sometimes I condition apply. With this brief introduction, I welcome Professor Seow Liang to join our live talk and enlighten us for about what we have in IMU for young dentists and dental practitioners in in Malaysia all over. So over to Prof Seow now.
Okay, thank you so much, Dr. Praveen. A very good evening to all. Yes, I am grateful that you have decided to spend the evening with us. Before we proceed, let me share my slide first. Can you see my slide now?
Yes, Prof.
Okay, so as Dr. Praveen has mentioned, so this evening talk is about an insight into pursuing postgraduate diploma at IMU. So let us go through a little bit more about what we can offer for you at IMU. Before we proceed, just allow me to share my career journey in prosthodontics. So first, I graduated from University Malaya in 1991. Well, you can guess my age then. Then I go further to pursue my master degree at Eastman Dental Institute, and I obtained my fellowship in dental surgery from the Royal College. And then after that, I pursue my PhD as well. And recently, last year, I have also obtained my postgraduate certificate in health profession education as well. So this is a little bit on my background. So what are the postgraduate programs that are available at IMU? Okay, we have 3 programs that we roll out. First is the postgraduate diploma in implant dentistry, which has commenced in 2016. So we have run it for 5 years now. So the next one that we will be rolling out will be postgraduate diploma in prosthodontics, which will commence in June, and postgraduate diploma in endodontics, which will commence in April this year. So for this PG program, I would just give an overall preview first. Why is it so unique? Why do you need to come and join us? First, this is I am accredited by MQA. They are the only postgraduate diplomas in Malaysia that are accredited by MQA, the Malaysian Qualification Agency. With this accreditation, you can rest assured there is quality assurance to all these programs. And they are delivered in a modular system to promote flexible learning that are suitable for general dental practitioners. So modular system meaning to say each program has 6 modules. And each module start with the first week that is face-to-face. Then after that, they will deliver in online platform in a flexible manner where students can learn or access the material at their own time. You can take part-time track or full-time track. Full-time track will be 1 year. Part-time track is 2 years. Means it's a bit more relaxed. Teaching and learning for all the 6 modules will be delivered within the first year. And thereafter, you have a little bit more time to complete your patient cases, because all these diploma programs emphasize a lot on clinical treatment, patient treatment. So there is a mentoring system. That means each student will have one specific mentor to them to support their learning. So if you have any issue in learning or whatever difficulty that you are facing, you can turn to your mentor for support. And we have very comprehensive library facilities as well. We have a lot of hard copy books, and we also have a very, very good pool of e-books and e-journals where you can continue to learn at your own time. And the other feature is patient treatment can be carried out at IMU Oral Health Center or at the patient's own student's own clinic. So it is flexible. You can bring your patients in to IMU Oral Health Center and being supervised by our own staff in IMU itself, or you can choose to treat patients in your own clinic. And we have a range of comprehensive facilities for patient care, which I will elaborate a little bit more later. And all this patient treatment will be closely supervised by experienced specialists at IMU. So treatment planning and execution of treatment, implementation of other modules will always be supervised by experienced clinicians. And we can also help to train your DSA as well. For example, if you are doing implant programs, while carrying out the surgery for your patients, if you wish so, you can bring in your nurses to be with us to watch how we do the scrubbing and arrangement of instruments, assisting in the surgery, and so on and so forth. So in a way, we can help to train your assistants as well. So when they go back to your clinic, they will be very well versed how to assist you to provide very good patient care. And the assessment structure has been designed to drive learning. So it's not just to pass exam. We really want to make sure that you learn, you achieve the competency that has been written down in the program itself. So the assessment structure has been set up in such to drive the learning to ensure that you achieve the competencies that is being required. And I will now go to each program. Each program has their specific features that will be more specific to the specialty. So the first one that is going to be commenced this year is the PG Diploma in Endodontics, and we will commence in April this year. So if you want to or you wish to, you can still enroll with us and enjoy the inaugural batch special fee. So this program will cover knowledge through face-to-face and also online activity as well, for example, case-based learning. And the skills development will be carried out in the simulation lab and also patient care as well. We have 5 endodontists now with us who will be able to provide one-to-one clinical training in endodontics to you. And there are 6 modules, as I mentioned before, for all the PG diploma program. The 6 modules for endodontics include fundamental science in endodontics, endodontic management of single-rooted teeth, endodontic management of multiple rooted teeth of moderate difficulty, rotary endodontics, management of endodontic cases requiring a multidisciplinary approach, and also management of field endodontics and any other endodontic mishaps. So as you can see, the 6 modules are comprehensively designed to ensure that you achieve the basic knowledge first, and then step by step, we bring you through simulation and to patient treatment care. All right, and we have very experienced teaching faculty for this program. Dr. Abhishek Parulia, Dr. Shekhar Bhatia, myself will be teaching in it as well on restorations of root-treated teeth. And we also have very well-known private practitioners, Dr. Lam Jet Ming. We have Dr. Sultan Omar Sharif. We have Dr. Preena and Dr. Swana. Dr. Swana is a radiologist, so she will help in the interpretation of radiographs and the CBCT as well. So I'm sure some of these specialists, you may have listened to their talk before because they have been conducting lots of CPD courses locally and also regionally. And also last year, due to COVID pandemic, they have been giving a lot of webinars as well. So you will get the opportunity to learn from all the specialists. So the next one up for the PG program is the PG Diploma in Prosthodontics, which will commence in June 2021. For this particular program, we have designed it in such that the knowledge and the clinical skills will be integrated to provide evidence-based and patient-centered care for partial and complete edentulous. So you will be trained in fixed and also removable prosthodontics as well. So you will get to know better in handling complex cases. For example, if you have cases that require FUMA rehabilitation for aesthetics and function, and we also introduce you to the latest technology and material as well. And the 6 modules that are covered in this particular program includes the fundamentals of prosthodontics and patient care, partial edentulism 1 and partial edentulism 2. We have 2 because one is more focused on fixed and the other one more focused on removable. And then we have complete edentulism. And module 5 is multidisciplinary approach in managing prosthodontic cases and management of complications and failure in prosthodontics. So again, you can see we thought from very fundamentals to give you the very basic understanding in order to step up your knowledge, then able to treat more complex cases in fixed and removable prosthodontics. So again, there will be knowledge and then simulation lab training, then patient care delivery in the clinics under the supervision of specialists as well. So the teaching faculty for this PG diploma in prosthodontic, including Procto. I'm sure a lot of you would know Procto. She's the founding dean for our dental school, and myself will be teaching into this program. And Dr. Parveen Kumar Patel tonight, who is with us tonight, Dr. Mandakini Mohan, and we have Dr. Shivani, we have Dr. Rohit, we have Dr. Lee, and also Dr. Nafis. So these are all very experienced clinicians who have been with us for some time. So the next one would be Implant Dentistry, the Postgraduate Diploma program in Implant Dentistry. As I have mentioned before, we have run this program since 2016. So this program has been based on the learning outcome for the PG Diploma in Implant Dentistry by the Royal College of Edinburgh. So if you come on this program, you will be prepared to sit for the exam for the implant, the diploma in implant dentistry by the Royal College of Edinburgh. So this program again covers knowledge acquisition through face-to-face teaching and also online lectures as well. So like I said, it's a very flexible kind of design across all these three programs, as you can see. So we have the first 1 week face-to-face. That means 5 days only you need to be in IMU with us for the face-to-face teaching for every module. And then after that, subsequently, for the 5-6 weeks, we all have online, like online discussion, seminar, case-based learning, and then you arrange to your own time as suitable to bring in patients or treat patients at IMU Oral Health Center, or you can treat patients in your own clinic as well. So you can see as such, it doesn't really disrupt very much of your own routine work. You can still carry on with your work and run your own clinic. All right. So this is the plus point of all these three programs. It's flexible learning, catered specifically for working general dental practitioners. And the skills development again, it's starting from simulation lab, then to the clinic for patient treatment. And this year, we have just revised the curriculum for the implant dentistry program to make it up to date, to enhance students' learning, taking feedback from our alumni and other various stakeholders. And we are running the new curriculum this year from October 2021. So again, this curriculum has been approved by MQA as well. And just to share with you, we have also obtained another 5 years of accreditation from MQA starting from last year. So the 6th module that has been laid out for PG program in implant dentistry include fundamentals and effective communication in implant dentistry, implant treatment for partial edentulous, and implant treatment for complete edentulism, entrepreneurship, professionalism and managing complications, and implant practice 1 and implant practice 2. Implant practice 1 and implant practice 2 are solely clinical modules where students can concentrate on patient care, on patient treatment. So again, as I have mentioned, students can choose to treat patients either at IMU or their own clinic. If students were to treat patients in their own clinic, we have our part-time clinical supervisors that can come to your clinic to provide supervisions as deemed necessary. Okay, and then the teaching faculty for PGDID include Professor Seow, as some of you may have heard of her, myself again, and we have oral surgeon Dr. Naresh Shetty, who is also examiner for the diploma in implant dentistry by the Royal College of Surgeons, Edinburgh. The program director, Dr. Ranjit Ajit Bapak, and Dr. Pravin Kumar Patir again, who is here with us today. And I would like to share Dr. Pravin Kumar Patir is very experienced in implant dentistry. He is also one of the examiner for the diploma in implant dentistry awarded by the Royal College of Surgeons in Edinburgh. So these are all very experienced teaching faculty. We have Dr. Shivani, Dr. Rohit, who are prosthodontists, and Dr. Swana, who is an oral radiologist. So I would just like to share with you the facilities that we have at IMU. We have very comprehensive facilities at IMU. Again, as you can see, we have a simulation lab. So as I mentioned before, we always have hands-on activity in the simulation lab first to ensure that you have achieved the preclinical competencies prior to patient treatment. And then after you practice in the simulation lab, you will be able to treat patients in our clinic. So this is our oral health center. And we also have library that have very comprehensive range of textbook as well. As I mentioned to you just now, we have hard copy books, and we also have a very nice and cozy setting for reading and for searching of other online material as well. I would also like to share with you for PG diploma programs, we have the ITI online academic campus. So we are the only one university in Malaysia that is been accredited by ITI, and all the students who have enrolled in the PG implant dentistry program can have access to this ITI online academic campus. And other facilities that we have to support the students' learning include CBCT. In IMU, we have 2 units of CBCT that you can take a 3D X-ray for your patients to do very comprehensive treatment planning and also evaluate the treatment modality as well. We also have intraoral scanner, 3-shape trials. So for prosthodontics, for implant dentistry, you can have a full digital workflow from digital impression up to your CAD/CAM milling. So this is our CAD/CAM machine. We have Aman Gebak CAD/CAM machine that enables us to mill out the restorations in-house. So like I mentioned before, from intraoral impressions until manufacturing of the restorations, it can be a full digital workflow. We also have a microscope. We have lab microscope and also clinical microscopes to help support students' delivery of patient care in the endodontic program. We also have the AquaCare as well, that some of you may have known, that can have various function from simple polishing until etching of your all ceramic restorations. So these are the whole comprehensive range of equipment that we have. All right, for implant program in specific, we also have the DTX studio. This is software planning for implant dentistry. So, and then as I mentioned before, if you come on as our PG students for our implant dentistry program, you are automatically getting complimentary access to ITI online academic campus. In this campus, there are a lot of resources and a lot of material for teaching and learning. There are a lot of cases that various very well-known speakers have put up on the campus itself for students learning. We also have physio dispenser for implant insertion and CBCT, as you know, for implant planning. So these are very specific to the implant programs. So next, as I mentioned before, the assessment structure for all these three programs have been carefully designed to support students' learning. So this is not just passing the program, but it has been carefully designed to ensure that the students have really achieved the competency that is intended for all these three programs. So for the PG Endo and PG Pros, the assessment structure is quite similar. So first module and second module do not have any exams. But for third module, we have a written paper. We have OBA, that means it's a one best answer questions, and SAQ is short answer questions. So this is a written paper on theory, that means to evaluate whether you have achieved the knowledge that we would like you to have. And then you also need to start submit case report as well. So for module 3, 4, and 5, you have to submit one case report each, which will accumulate 10% of the marks towards the final exam. And after module 6, we will have another written paper which carries 20% and OSCE. OSCE is the objective structured clinical examination which carry 40%. So as you can see, because this is a very clinical based program, the clinical component for this assessment carries 70%, whilst the theory component carry 30%. So that comes to 100%. So this is what we call the summative assessment. That means it's a high-stake program. In between, we also have little quizzes and other competency tests as well, or assignments, seminar presentations. These are the formative assessment. The main purpose of this formative assessment is to ensure that you have learned the learning outcomes that we intended in the program itself. So this formative assessment do not contribute to the high-stake exam, means the professional exam. This formative assessment is mainly for learning. And for the assessment structure for PGDID, we have revised it. As I mentioned before, we have a new revised curriculum, which is an enhanced version after taking in all the feedback from our alumni, from external examiner, and also our industry partner as well. So FA is formative assessment and SA is summative assessment. So as you can see, the summative assessment again is 30% of theory and 70% of clinical. All right. So this is the makeup of the assessment structure for a one-year program. as I mentioned before, you also can take it as a part-time student. That means you can take 2 years to complete. So this is a 2-year part-time intake, because if you think that, oh, 1 year is too rushing for me, I need to take care of my family, I need to run my own clinic, I may not be able to dedicate so much time to this particular program. So no worries, no worries. We have a 2-year part-time track as well, where you will have a bit more time to treat your patients, complete the patient treatment, then only sit for the exam. So this is, as I said, is a flexible learning. We would like to encourage people to learn at their own pace as they go along. The whole idea is to ensure that you learn, not just getting a diploma, but do not achieve the competency. So at the end of the day, our pride is our alumni is a very competent in the field that they have come on with us. For example, if you have taken endodontics with us, if you become our alumni later, 3 years, 5 years down the line, you will be recognized as one of the practitioner that is very good in endodontics. So this is our aspirations for all our PG students. So this is an overall view of what I would like to share with you for all the 3 PG programs that we are offering for this year. So over back to you, Dr. Pravin. Dr. Pravin, your mic is muted.
Yeah, my apology. Thank you very much, Prof, for this wonderful and very elaborative and informative session on all the 3 postgrad programs, especially in dentistry in IMU. And we got some couple of interesting questions, and they are I think they are uh, quite relevant as well. So I'll without wasting much time, I'll directly go to these questions. So first question is that what is the difference between full-time and part-time, and is it in the number of subjects?
Okay, thank
Yeah,
you so much for the questions. Full-time and part-time learn exactly the same.
right,
So there's no difference in the subject. As I mentioned before, each program has 6 modules. So all the full-time and part-time students will attend the 6 modules in the first year. The 6 module will be delivered in the first year. If you are taking full-time track, then you will complete your patient treatment and all that
right,
within a year. So that means you need to be really working very hard. For
right,
part-time track, then after completion of the 6 modules, you have a bit more time to complete your patient treatment. You know,
right,
I would also like to add on, for each program, in order to be eligible to sit for the exam, you need to complete certain amount of cases.
right,
For PGD Endo, you need to complete 25 cases, record them, put them in a logbook as an eligibility to sit for exam. For
right,
PG Pros, you need to complete 10 prosthodontic cases.
right,
For implant, you need to do 10 treatment plan for 10 cases and then complete 6 implant cases.
right.
All right, so this is the eligibility. So for
Yes,
full time, that means you need to complete it within a shorter period. For part time, you are given more time.
yes,
So for our full time, it's 1 year program. Maximum, you do it 3 years. So that
right,
means you need to complete it within 3 years.
yes,
For part time, it's a 2-year program. You have 4 years to complete the program.
Yeah.
Yeah. So I
Yes.
hope
Yeah,
it's
I
clear.
think it's quite clear. Prof, can you just unshare your screen so that we can have
Oh yeah, yeah, yeah.
yeah, face-to-face chat? Before I go, yeah, thank you very much. So our
Okay.
next question is, are the face-to-face classes compulsory? What if I cannot attend all 5 days of classes during those face-to-face weeks?
Okay. Thank you so much for the question. The 5 days face to face is compulsory in a way. When you enroll in the program, we would have given you what we call an academic calendar. So you will know which 1 week is the face to face. Then you can plan your schedule accordingly. You know, so
Right,
we do give a little bit of leeway. Maximum we require you to attend at least 80% of the face-to-face classes.
correct.
Mean you can skip 1 day
Right,
of the 5 days. And then for the online classes, it's all recorded. So let's say if you tell me, oh, I have something urgent, I can't come online for the classes, no worries. They are all recorded. You can always view them back.
right.
Yeah.
Yes. So that's another good advantage of going for online, and you can have uh, access to any of your online classes at your ease after your practice and so on. Thank you, Prof, for another explanatory answer. Let me just go to the another question, and that one is: are the cases provided by the university for all programs? Meaning, how is university helping to get the number of cases for the students in that way, those who are
Okay.
practicing, and of course those who are not practicing, or how it goes? Yeah.
Okay. Thank you for the questions. Uh, we will definitely try our level best to provide patients. All right.
Right,
So if students themselves would like to bring their own patient and be treated by oral health center,
mm-hmm.
we always welcome the students to bring in the patient as well.
Right,
We have, like for example, we have an implant clinic in our university, so we do a lot of screening of patients and all that. So we will definitely try our level best to provide patients for our students. So far I must say that we will be able to provide patients, most of the patients for our students, and our
right,
students also help to bring in some patients to be
right.
treated with us as well.
Yes, perfect. And that adapts my another question, which is quite connected to this earlier one. Is like, let's say you have mentioned that the students can treat their patients in their own clinic as well, and
Mhm.
will they get supervision for the patient treatment, and how you're going to assess them if let's say one student has a so good number of patient flow in their own clinic and they want to do some cases in, of course they will do the cases in their own clinics, and how the university will be testing them being part of those cases as a part diploma submission.
Yes, yes. As I mentioned before, it's flexible learning.
Right,
Students can choose to treat patients at their own clinic. We, some of us can actually come and supervise the students in their own clinic. For example, myself, I can actually include the students' clinic in my APC, and I will be able to supervise. In
right,
the case that maybe if students are outstations and maybe in Penang or Johor or Kelantan, we normally have part-time clinical supervisors who are experts in the field as well that can come to your clinic. For example, if I can share with you, for implant dentistry, so far we have clinical supervisors that we have appointed in East Malaysia. Also, we have supervisors in Johor.
right,
So as long as we know where you are, we will definitely try our level best to find experts in that area that is close to you, and will be able to come to your clinic to provide supervision for your patient treatment. So these are formally being appointed by IMU.
Right. Yes. So those are few experts which IME will be yes particularly
Engaging,
given the
yeah.
engaging them to evaluate you in case when IME staff are not able to travel for long. So in short, this all these three programs are made up uh, for all Malaysians, all Malaysian dentists who are busy in their practice, and they want every possible way of flexibility and procure and go for their post graduation courses.
Yes,
Yes, thank
yes,
you, Prof.
definitely.
Yes,
And
we
I would also like to add on, all the treatment plan will be discussed with the supervisors or the clinicians at IMU. That means all the treatment planning would have been discussed with our academic staff in IMU
right,
and being approved first prior to being supervised by external
right,
part-time clinical supervisors. So
right.
all this will be documented. And
Yes,
how these sessions can be conducted, it can be conducted online. You know, now we're so used to having Zoom meetings, and you know, we have Microsoft Teams as well.
right,
So all the clinicians here in IMU are very approachable and also reachable as well,
right.
you know, for all these three programs.
Yes, thank you, Prof. So there is one more question from participant Paigi Ong, and she's
Uh-huh.
asking their Prof Seow, how often is
Yes.
the online lesson for implant dentistry? An online lecture will last for how long? Thank you. So she's just asking about the duration of online lectures, and I think so.
Okay.
Yeah.
All right. So each module is about 6 weeks. All right.
Right.
So
Right.
first week will be the face-to-face, and you were left with about 5 weeks, right?
Right. Right.
So online activity will be alternate week in general.
Correct.
Right, so maybe one week you will have seminar and case-based learning, and another week you don't have online classes, and another week you will have online case presentations, you know,
Right.
a lot of case-based learning.
Right.
Students will present their cases and discussion, and the lecturers will also present cases and discussion. So
Right.
it's a very clinical based kind of activity.
Activities.
So
Yes.
normally the online activity, the seminar or the case-based learning, about 1.5 hour kind of
Right.
timing. Yeah.
Right.
So we always bear in mind that you have a busy practice, you have patient to attend to. So we sometimes we actually accommodate to your time. If a lot of students in that cohort cannot make it, we will try to find a time that most of them can make it. And
Right.
then also, as I mentioned before, all these online sessions are all recorded, so you can play it back as many times as you want.
Right. Thank you, Prof. Meaning, I remember one of our PG Diploma in Implant Dentistry program.
Yes, yes,
We have conducted some of the case-based learning sessions even at 8 o'clock in the morning, and
yeah,
sometimes
correct.
we you choose to go and sometimes 4 o'clock, 5 o'clock, depending upon the clinic time of that particular cohort, and in that way, of course, it's flexible. And
Yes,
online learning will be compiled of multi-disciplinary activities, teaching learning activities, like Prof has mentioned about case-based learning or seminars or journal clubs or any given task, that kind of activities.
yes,
Yes.
correct,
So
correct.
we have another question from attendee is, do we need to have working experience before joining one of the programs? Yeah, it's very
Okay,
important question, Prof. Yeah.
yes, yes, very good question. Thank you for the questions. Yes, you will need to have working experience before joining the program.
Right.
For PG, Endo, and all these program, you need to have at least 1 year of clinical practice experience. Okay, so it's clinical practice, not 1 year after you graduate. So let's say you, for example, if you graduate in September, you only get your posting in maybe March or April the following year.
Right.
So you need to count from that time point onwards.
Right.
So you
Perfect.
need to have 1 year of
Of
clinical
experience
practice experience. Yeah, that's
minimum.
right. That's right.
Correct. Yeah.
Yeah.
Thank you, Prof. So there is one more question in specific about postgraduate diploma in endodontics. So with regards
Mm-hmm.
to endodontics, how do the students become familiar with using dental operating microscope for patient treatment?
Oh, okay. Very
Yeah.
good question. As
Yes.
I emphasized before, we always have simulation lab training first,
Right.
then only we do patient treatment, right? We don't expect, because to use dental operating microscope is a big paradigm shift,
Right.
so we will familiarize the participants in the preclinical lab first.
Right.
So we have a microscope in our simulation lab as well. So during the face-to-face week, you will have simulation practice in the lab,
Right.
and then
And
the microscope is there. So if you are free, you can come in as much time as possible to practice first before you use it in the clinic. So
right.
because we also have a dental operating microscope in the clinic as well. So it's like a good transition
Right.
from preclinical simulation. You use the microscope,
Right.
familiarize with it, then you go to the clinic and use the dental operating microscope on real patient.
Right. And if you really wish to do one of your own clinic patient under microscope, you just it is free to come to IMU, just get your patient there and use our microscope. It's as
Yes,
simple as that. Thank you, Prof.
correct.
Yes. So another one about implant dentistry in specific, and for implant dentistry, is there any particular implant system I have to use? So
Oh, okay.
yeah.
So very good question. So we do not specify any implantation system in a way. We have a few industry partner with us. For example, Noble Biocare, we have Zimmer, we have Asatec, which are all major player in the implant
Right.
dentistry field, right?
Right.
So we teach the basic principles of implant dentistry, and then you can try your hand on all these systems that I mentioned, and then decide for yourself which one you prefer to use. These are all well-known implant system that has
Right.
proven track record with a lot of clinical evidence being published in the scientific journals.
Right.
Then you decide which system you are comfortable with using. Then you can carry on at the later stage when you are familiar with implant placement.
Right.
All right.
Thank you. Correct. Thank you so much, Prof. So we are almost at 8:48 p.m. now, and we have a couple of more questions I would like to just quickly take on before we
Mm-hmm.
yeah, end this live talk session. And that one is about yeah, prosthodontics, and they are saying that can I learn smile designing or CAD/CAM restorations with digital impressions and so on. So what's your answer, Prof? Yeah, would love
Yes,
to answer this question. Yes.
yes, definitely. Like I mentioned before, we actually have a main principle is for oral rehabilitation to rehab back aesthetics and also function. At, at this point in time, we have also appointed a very well-known prosthodontics from India.
Yes.
All right, you remember
Yeah.
Praveen?
Yeah. Dr.
Yeah,
Harsh is a very good friend of mine from Nagpur, and is yeah, well-known figure in India
yeah,
in CAD/CAM industry, and we're lucky that he has also one of our visiting lecturer panel from PG Diploma in Prosthodontics.
that's
Right.
right. So
Yes.
we will definitely learn smile design
Perfect.
and
Yes.
also CAD cam as well. And
Right.
I know Dr. Harsh is actually one of the pioneer using CAD cam dentistry in India.
Yeah,
So
yes, I
yeah,
remember back in Nagpur, I visited his clinic almost 10 years back when he was using his tabletop CEREC and CAD CAM. And yeah, meaning it is still there, and sky is the limit for digital dentistry now. Is open Pandora's box. And yeah,
that's
so
good.
we
Yeah,
we are we are like into a practice in IMU for using very handy, and now we are frequently using intraoral scanners and CAD CAM restoration, so you can take help of that facility as your diploma students. Yes. And with this, I think, Prof, I have almost done with the questions, and we are 8:50 and ready to conclude this session. Before that, do you like to add any closing remark?
yeah, sure.
Yeah,
Okay, so to recap all, now we have three programs.
Prof. Just before ending, there is
Yes.
one more question. I'll just quickly have it. It's from Care E. Theo, and she's
Uh-huh.
asking, I think, do we learn composite injection molding?
Okay,
Yeah.
we don't really teach composite injection molding in particular per se,
Okay.
but it will be taught as a general for knowledge, because we actually don't have the equipment in IMU for
Okay.
composite injection molding. But
Sure.
as I mentioned, we have a CAD/CAM machine that we can always use
Right.
CAD/CAM for milling.
Right.
All right.
Yeah. Thank you, Prof. So over to your closing remark now, before we
Okay.
conclude.
Thank you so much, Dr. Pravin.
Thank you, Prof.
And I would like to thank all who has spent their evening with us here to learn a little bit more about our PG diploma programs, the
Right.
three programs that I mentioned in endodontics, in prosthodontics, and also in implant dentistry. So we are all here for you. So if you have any further questions that you didn't manage to ask for today, please feel free to ask us whenever you pop into your mind. You can always
Right.
send us messages and things like
Yes.
that. Yeah.
Yes.
All right.
Yeah. Will so with
And
this,
also this Sunday, you want to mention about this Sunday?
yeah, so this Sunday also we have IMU Open Day, and you can definitely can be a part of this, and then take some one-to-one conversation with the teaching faculties with particular programs, and you can have some more questions about that and get it clarified. And we'll be almost giving away almost 800 ringgits towards your registration fee for the course and so on. Yeah. So thank you so much. We'll be in touch, and we'll be get back to it. Some more questions I can see on the screen, but we'll be with the time constraint, we have to stop now. But definitely get back to you, those who are actually having some more questions. Thank you so much. Thank you, Prof Seow, for
Dr. Praveen, I
yeah,
think there's one last question.
yeah. You can take one then, Prof. No problem.
With
Yeah,
no, I can see some one of the participant have
yeah,
just
sure.
posted with regards to the endo program.
Mm-hmm.
Will there be a delay in completing a module if I have problems with finding cases?
Yeah, right,
Okay, all right. So as I mentioned before, to be eligible to sit for the final exam for the endo program, you need to complete 25 cases.
right,
So you will finish all the modules in the teaching and learning. Then thereafter, you will take time to complete all the patient cases. So like I mentioned to you, for full-time students, you have up to 3 years to complete patient cases and sit for the final exam. For part-time track, you have up to 4 years to find cases and complete the patient cases requirement and sit for the exam. So
right.
it's not an issue. So you do have time to finish the cases. And of course, as I mentioned before, we will definitely try our level best to help to provide patients for you in order to complete your requirement.
Yes, rightly said.
Yeah.
Thank you, Prof, for this last question as well. And with this, it is time to stop these sessions now and live session, and see you on Sunday. And you can always drop an email to IMU for any further queries, and we will be happy to help you in any small question to answer. Thank
And
you,
I would
one and
also
all.
like to add on, Praveen.
Yes, Prof.
Can I just add on as well? Because for the endo program and the prosthodontic program, because this year is our inaugural intake,
Right.
means
Yes.
our first intake, right?
Correct.
So we are actually have a special 10% of discount for the intake for this year.
This year, yes, that's
So
another
yeah,
interesting perk. Yep.
correct. So
Right.
that would be a lot of savings of 10%.
Right.
Yeah.
Yeah, with this, I
Okay.
thank our IMU marketing team to work hard backstage, and I thank you one and all from our marketing department for making this show uninterrupted and happy going. Thank you so much, Prof, for answering all questions and your wonderful, elaborative, informative presentation earlier. And with
Yeah,
this,
most welcome.
yeah, with
Thank you
this,
so
I
much,
thank you so
Dr.
much, Prof.
Praveen, for moderating the session.
Thank you,
It's
Prof.
been a wonderful session.
Yes,
And
of
thank you
course.
so much to all the participants for
Thank you,
spending the
participants.
evening with us.
Yes.
Yeah.
Thank you
And
so much
thank you
for
to
all,
the
one and all.
marketing team.
Yes. Do take care. Bye bye. See you soon.
Okay,
Yeah.
bye
Bye
bye. Good
bye. Take
night.
care. Good night.